Applied Prevention Science International presents Prevention Portraits, a series of informal interviews with scientists, professionals, and other stakeholders who are contributing to prevention knowledge and practice around the world. We hope to bring you closer to their brilliant careers, experience, and professional paths in the prevention field. On behalf of APSI, thank you for joining us. Enjoy. The views and opinions of our guests are personal and do not represent those of their institutions or Applied Prevention Science International.
Hi, everyone, and welcome back to Prevention Portraits. I'm Susan David of APSI, and together with our president, Dr. Zilli Sloboda. Hi, Zil.
Hello.
We want to welcome Dr. Rebekah Hersch to Prevention Portraits. Dr. Hersch is a member of APSI Scientific Advisory Board and is Interim Associate Vice President for Research and Innovation at George Mason University in Fairfax, Virginia. Hi, Rebekah. Thank you for joining us today. We'd like to get started with hearing a little bit about what you're doing today, your work and your focus.
So thank you so much for having me. It's really a delight to be here. I've had a slight change in focus to some extent from a little bit from prevention to treatment as my move to George Mason University. I am one of the multiple PIs on an NIH-funded initiative called JCOIN, the Justice Community Opioid Innovation Network. It is part of the HEAL initiative that I'm a multiple PI on the Coordination and Translation Center with Faye Taxman at George Mason University. And my role on that is to manage a rapid innovation grant program in which we are funding relatively small, quick turnaround studies looking at the intersection of substance use disorder and justice-involved populations. So we know that certainly the COVID pandemic has impacted greatly those individuals who are justice involved, those in our jails and in our prisons, and those who are being released from those with substance use disorder, and the lack of connection to then community services. So that has been a new focus of mine. Remain focused on prevention with the work that I'm doing with APSI.
That's great. Zil, would you?
No, that is really exciting. That's funny because my career is, I actually did some epidemiologic work and then I was doing treatment evaluation and then do prevention. So, and of course, once you do that, you see the connections and the need to integrate the two. I think that's really exciting. One of the things that you are very well aware of is that we all didn't start out when we were 10 years old and saying, I want to be in the prevention field or the substance abuse field or the treatment field. So what we've tried to do in the portraits is sort of talk about people's stories of how you got to prevention. You know, they're all different and they're all interesting.
Yeah, I'd like to think of, I've often said, if the road to my career, if the shortest distance between 2 points is a straight line, that my career has more like been a wandering journey where I took turns, took time off to look at the scenery, came back. And so that's how my journey started.
Yeah.
Going back to, so I'm a psychologist by training, and I was really interested in clinical psychology and severe psychopathology, and was in a Ph.D. clinical psychology program at Clark University in Massachusetts. For a whole variety of reasons, I ended up withdrawing from that with my master's degree to move to the DC area, and had the tremendous good fortune to actually just be hired really as a research associate, a research analyst with Royer Cook, who was a pioneer in workplace substance abuse prevention or substance abuse prevention among working adults or among adults. But I also knew that I had not finished. I had left a PhD program with a master's. That is not a terminal degree. And I always wanted to finish. And I presumed that I would finish in clinical psychology. But I was working full time. And there is very few and none in the DC area at that time that would allow me to work full time and go to school part time in a clinical program. Again, had the tremendous good fortune that George Washington University had a program in applied social psychology with an emphasis on health. And became was accepted into that program and received my Ph.D. in that program. And we had a number of faculty members who were doing research in substance use. And so that, along with the work that I was doing with Royer, sort of started my career in substance use prevention and behavioral health, and found a home at ISA Associates, the organization that Royer started for 30 years, and ended up being a partner in that organization and a vice president and senior research scientist. And so really grew up learning from him and with him, having my own career in substance use prevention among working adults, but also in other aspects of behavioral health, and that we learned from what we learned in substance use. And it's been great. It continues to be. It's just both my enormous good fortune to have had that experience. So while different than what I thought, what is also true, I learned early on, and why I became sort of fascinated, I think, with research and evaluation, and prevention to some extent, sort of the two things that stick out in my mind. If we build interventions well, if we can implement them, if we can use evidence-based practices, we can impact many more people than I ever could have as an individual clinician, without question. And so that was exciting, to have a much more major impact, if not a personal impact. It's a little harder to see the results of your efforts when you do that, but also that we can prevent so much more disease than we can ever hope to treat if we change our practices. And that's really also hard to sell sometimes to people, because it's hard to see the impact of that.
Yeah.
But we know that. It's just.
Yeah. I see a lot of parallels in your career path to mine. In fact, I had one boss who, in my evaluation, he told me I was Byzantine, and I thought that was a positive thing, because I thought, I was eclectic. I brought a lot of things together. He didn't mean it, and I said, "Well, thank you." And he says, "No, I didn't mean it as a compliment," because he couldn't see the connections that I could see, which is what you're obviously seeing. So it's yeah, it's been kind of fun. The journey has been really fun for me. I really, looking back on it, where you get frustrated because the path you're on is not what you expected, but
yeah, and it's really, again, my early career, again, in severe psychopathology, I worked at the maximum security facility for men in Massachusetts, Bridgewater State Hospital.
Wow.
And so I would read books about people with severe psychopathology. So, and also those people that, sort of the Jeffrey Dahmers of the world. I had lots of books on them. And so when I first met my husband, he looked at my bookshelf and was like, this is different. But not severe psychopathology is what we're dealing with now, but that's sort of
That's great.
Still fascinated by serious.
One of the things that Susan and our APSI staff trainers are particularly running into almost every group that we train is the lack of recognition that workplace is a real place to do prevention, not only for the people working there, but also ways of getting to their families, parenting programs, et cetera. And of course, I'm wondering if you could talk a little bit about that, because once people are aware of that, it's like they're just so excited about that potential.
There's just no question. We spend, so where do we do a lot of adolescent and childhood? We do that in schools, because that's where our children are. So where would we provide services to adults is where they spend a significant part of their day. And so that's, as a setting, it makes complete sense. But it's also for workplaces. It's a lot of reasons why I think that that's true. Workplaces think that this is a personal problem, not a workplace problem.
Yes.
And so not a setting problem. And there are both setting issues and issues in the physical plant or environment in which one works, the culture in which one works, and also resilience and things that we can build into the individual. So both of those are true. But for the longest time, and we didn't realize we had to, and there was ultimately some studies on this, the return on investment for workplace substance abuse, much like the return on investment for wellness, I think, And so why it is a workplace issue, we needed to make that argument. We needed to make the argument, whether it's a return on investment, whether it's a corporate responsibility to community, whether it is how do you keep and retain good workers. So that became absolutely an issue that we needed to address. We also needed to address, once we sort of could get into workplaces, that substance use prevention, and some say treatment, there were these different buckets. So there was the employee assistance program bucket, and so they dealt with substance use. And there was sort of the wellness folks, and they dealt with not that. They really need to be integrated. They are not.
Yeah.
So the purview of workplace became, we wanted to do wellness, in which substance use prevention is part of. But also understand that there is as an early intervention and potential treatment, and working with the employee assistance programs. And they often didn't play well together. And so trying to bridge that gap as well. And then I think the third thing that you mentioned, Zilly, is, and I'll talk about this, I think the sort of lessons learned to some extent, things I walked into naively in workplaces and went, oh, that's not going to work, is it? We'll talk to, but it's a way to get, a way to address parenting and families. It's also a way for people to look at their own substance use. So, an intervention called Parent Power, which was designed, again, as a workplace prevention to help understand adolescent substance use behavior and help parents navigate that and address that and have the tools to talk with their kids, or to recognize issues when needed, but also to look at their own behaviors. And we did that a bit on the sly, and I get that. But they are both. And I think workplaces came around to the notion of also just workplace wellness and environmental factors that impact personal behavior. And again, but it's not there yet. We still make that argument every day, I think, when we're in workplaces, as to why it's an important setting.
Yes.
And why it helps, why there's a workplace argument for it, where there's a bottom line argument for it, but also why there's a corporate responsibility argument for it.
Right, exactly. Yes. Susan?
Well, one of the questions we love to ask our advisors is, when Zilly called you, these many years ago in 2013, and asked you, did you want to be part of our UPC, our Universal Prevention Curriculum? Why did you say yes?
Well, is the short answer because Zilly asked? Because that's
of course, that's what we all said, yes.
Because again, came with an extraordinary reputation in the work that he'd done prior to doing this work. So that was certainly part of it. But not, it became an exciting, it is an exciting endeavor, remains an exciting endeavor to look at this from a universal prevention, to look at this, how does this piece fit in with the other 7 or 8 colleagues that we're working with, to work with people who are at the top of their field. That was the other just sort of extraordinary thing, to get this group of people together and talk about these things. So workplace doesn't exist in a vacuum. That's not in a community, that's not connected to the schools, that's not connected to some environmental issues. And so we had our slice of it, but to be able to think about this in a much more holistic way was enormously exciting. And the return for me has been even better than I had hoped it would be, and the colleagues that we've made and the work that we've done. The other piece that was really exciting, and of course I think also reflected how US centric, or maybe Western centric, some of my thinking was the idea of learning from other places, other cultures, other aspects where this is happening in the world. What is similar, but what is remarkably different, in how I think about what we do. And so that was, I don't think I knew that going in. I honestly said yes because Zilly asked, and it seems enormously exciting, and the idea of working with this group of people seemed enormously exciting. But then what we learned from that, or what I learned from that.
Sure. And I agree 100%. I mean, well, for Zilly and I, who've worked together for years before, the idea of transferring our knowledge, of actually making this process happen, of taking the science you guys worked on and delivering it to people who can use it for their work and make that happen is extraordinarily exciting. And you touched on a little bit of what else I wanted to ask you, because I remembered our wonderful excitement in 2014 to be in South Africa and testing the workplace. Well, I was there for 19 days. I went over the 2 weeks, and it was so exciting, and working with the people from all around the world, really. It was just so extraordinary. But I just wanted you to kind of share a little bit of that. And of course, they also did workplace with Latin American audiences, and sort of your take on that experience of dealing with testing out our intervention.
Yeah, I think well, I mean, the place itself was just extraordinary. And then working with all the people, it's to see the commitment worldwide to this. Again, I lived in a smaller world, and so to understand how other people thought about this was just amazing. But I do remember, and I can't remember if it was that training or one of the other ones, sort of recognizing how I believe how US-centric a lot of my language was, and a lot of the work, and how that needed to be changed. But also things that I took for granted that I recognize we can't take for granted. So I might say in workplace prevention and in evidence-based that you must have the ability for people to come forward to say, I'm struggling with something. I may have a substance use problem. I need assistance, and to be able to accommodate that, and to think about that, and to look at their workplace, and to get an early intervention, and think about the whole wraparound services. And to have somebody say to me, if somebody comes up to us and says that they have a substance use problem, they will be arrested.
Wow, yeah.
Okay, so I need to rethink what I'm saying, because there may be places where we need changes in policy first, at local, regional, state, country levels, and to think through that before I just make a blanket statement as if that's okay in every country, because it makes. And that was an amazing moment for me, a humbling moment for me to say, you don't have all the answers, because you don't know how this works. In places where they desperately want to do this, but they cannot legally.
Yeah.
So how do we, or children may be taken away, or something else that impacts their ability to do the things that they want to do.
I think one of the issues is that you just raised is how important it is to engage those we're interacting with. I think at the beginning, everyone worried about cultural differences as sort of this big thing out there. But once you start engaging and you get input, and you're sharing your knowledge and saying, how can this work for you? I mean, it's a big challenge, for parenting, for instance, that's very cultural. Yeah. It's going to be different in every place. So how do you do that? And I think that's been one of the really exciting parts of working this process, is really learning these unknowns in our world.
Exactly. And I was struck by how, I think at first there was this, instructor-student kind of dynamic, and folks were not always easy to say, I don't think that's right, but my co-trainer and I were very open about, this is what we've built from what we've learned. We need your help in understanding, does this work? Is this language right? Is this language clear? Have we missed the mark on something, and do we need to broaden it to understand what different are? Yeah. And so it then became a team effort, I think. It became more of we're working together for this thing, which is great. And I think they felt heard. I think was important.
Yes, we were heard, and we made revisions of almost every all the traps we had, because we had such great input. Yes, I think you stated very nicely. All of us were very concerned about how this was going to play out in a variety of different areas of the world, and I think it underscores the importance of making this. We have to have an international acknowledgement of the science, and it can be adapted for different settings and different cultural settings. And I think we've learned that, and you're right, we work with some phenomenal people that were able to make those connections for us. We're doing a lot of training here in the United States now, and even though there's still differences, and you could, the broad definition of culture, and organizational culture, for instance. So we're working with trying to adapt the training for their needs, and that information feedback then improves what we're doing. And the other thing we've noticed is people are get engaged together. And this one of the things with Zoom has been actually converting over to virtual training has, I thought, we were really frightened we were going to lose, because that personal connection, I think, is important. And yet we've been able to create that with meetings, and people get very engaged, and we've been enjoying people meeting each other that would not necessarily know each other, because traveling is expensive. Either they couldn't afford it or their organization couldn't afford it, but they were able to do Zoom. And it's been a very interesting, exciting experience, that all around. I mean, the whole international part of this has been really wonderful. But here we are with COVID. I know with your work that you're doing at the university that you were talking about, and you did mention COVID there, but COVID for employers, how is that working out?
Yeah, we don't. I mean,
so challenging.
There's so much we don't know yet. Well,
yeah.
We do know that there's been just an enormous increase in opioid use disorder and a substance use disorder, and overdose, opioid overdose, and other substance use overdose. We know that. We know that the touch points that a workplace provides, or school, or any place else, are not there. And so that's part of the issue. And so workplaces, I think, have been scrambling in the, how do I connect with my employees? How do I provide services to employees? How do we do wellness remotely? How do we make sure that they're okay? I don't think we have answers to that. I think that those are been challenges. And I think they're going to be challenges that I think that we need to address, because I also don't think that a year from now, and it'll probably be a year from now, where we're a little more, whatever new normal is going to be, will not look like it did a year ago. I don't think workplaces will look the same.
Right.
The cost of where people work. So maybe people won't be in offices as much, or will not be there every day. What does that mean? How do I monitor behavior? I mean, there's things, I think I said this in my presentation, about people would do things at home, have a drink at lunch, have a drink at 3, even though they're still working, that they simply wouldn't have done in a workplace.
Right. Oh, yeah. Sure.
To relax, or I'm anxious about a presentation. I could take something right now because I'm at home and no one's going to see me do it before I do my thing that I need to do. Whatever it is, we don't see them at home. And so there are, I think, challenges around the increase in substance use behaviors that in a home environment or a telework environment that may not happen, or would not happen very likely in a work environment. And then it's how to provide services. I think we can provide services. I think perhaps we can provide services better. Not better, but more people, as you've said, more people can
access them.
Can access. People can do it anonymously-ish. want to. That is, they don't have to have their picture, they don't necessarily have to have their name on there, but can attend things if they're just checking in, if there's no attendance needed. They can learn. So I think there's opportunities. And then I think we have to create new opportunities for reaching out, for figuring out how to have those touch points to check in with employees and supervisors and give them access in a way that are different than we've had before. So it's a challenge. I don't have the answer yet.
Yeah. Do you know if any researchers are looking at that issue now?
They are, and I don't have the research in front of me. I think we discussed it, and I think we gave some in the slides that we presented during our presentation.
Your prevention talk, yes.
So there's some there, and we can certainly provide those. So they're beginning that. I also think there's going to be a long tail on this and a lot of research to be done.
Yeah, no, I think you're absolutely correct. Yesterday we were doing a prevention talk on family and parenting with Doug, and it was interesting that they were able to deliver a strengthening family program 10 to 14 to people that they wouldn't necessarily have been reached at all. It was a very interesting discussion, and we're going to be posting that soon so people can look at that. So I think we're learning a lot about how to deliver these interventions virtually. We've got to be upbeat about that part. We got to be looking forward to it. We've got planning. I think we've got learning a lot now that we can plan for. As you say, we're hopefully back to whatever normal is going to be, the new normal. I hate that expression. But
there are opportunities in telemedicine and telehealth and in interventions that are the sort of relapse prevention that, insurers and other people said we simply, well, that's not possible. We can't monitor that kind of thing. And then when we had to, they did. And so I don't think we're going back to not having that as an option.
Exactly. I think all these is just, it's a very exciting time. It really is.
For things like parenting programs, for things like some of the workplace programs, if they're not when you're at work, the idea of providing childcare so that a working adult can attend something, all of those things, if you can provide a virtual way to do that, that is just as engaging and just as good, then you do have the opportunity to reach people who would not have attended or could not have attended for a variety of structural reasons in their lives.
And I think that the research, I don't see the support for the research in that area. I think it's starting now, but especially prevention. But we really need to, I think a lot of our colleagues who have programs are concerned about the research part of it. Many, for instance, Strengthening Family group that we talked to yesterday are monitoring, and at least not necessarily doing a randomized controlled trial, but at least they're getting some preliminary efficacy information that I think will be useful for the future. So, it's very exciting, I think. If one can be excited at this time, but yes.
I think you do have to look at what are the opportunities. What has been made possible because we understand we can do things differently. That we could, if we should still have what we've had that's been evidence-based, that's worked well. But what other opportunities to reach groups that we might not have and simply said we couldn't reach, not possible.
Right.
That we might be able to because we have all types of ways of doing it.
No, great. Susan, do you have any other questions?
No, I think you've summed it up, Rebekah. It's great.
Anything else you'd like to add, Rebekah?
No, I think the only thing with regard to workplace, and this, that we're just giant advocacy and advocates for, is the notion of substance abuse prevention as part of wellness.
Yes, that's very important.
Wellness,
absolutely.
When you talk about stress management, when you talk about anything, it is the opportunity to talk about substance use. It's hard to do that as a standalone. It's harder for workplaces to recognize that as a standalone, and I'm not sure that they should. I think it is part of wellness.
It's part of wellness, right? It's an opportunity for employers to support the health of their employees. Yeah,
absolutely. And then it destigmatizes all of that as well.
Yeah. That's right. Yes, indeed. Okay. Great. Thank you again. It's lovely seeing you, and take care and happy Hanukkah.
Yeah. Happy Hanukkah. Right.
both a safe, happy, and helpful holiday season.
Holiday. Yeah,
Holiday season, but also just peace in the new year, and looking forward to some better news in our new year.
Yes, absolutely. Thanks again.
Thank you.
Bye-bye.
Bye-bye.